Counselor Rosenthal.
Present, did you see? I didn't hear your name called.
Counselor Gonzalez.
Present.
Counselor Huang.
Present.
Counselor Nolan. And Deputy Council President Simpson.
Present. And President Peterson will arrive late due to a conflict. And Councilor Lewis will have to leave at noon due to a conflict.
Me?
That's for them. Oh, scratch that.
Oh, where
last
am I
piece.
going? Somebody tell me. Otherwise I'm staying.
Well, I guess you don't have a conflict, so we'll scratch
Check
that.
on that. I think I'm here.
Okay. Before we begin our agenda items, can we please play the safety video for our in-person attendees?
I'm Jason, and I'm an event production manager. Here at the Portland 5 Centers for the Arts, safety is our #1 priority, not only for our guests, but for our staff members. I'm at the Portland 5 Centers for the Arts, and you're at the Metro Regional Center. The council chambers are located on the 3rd floor. In the event of a fire or fire alarm, please exit through the door in the northeast corner of the room. Go down the stairway to the 2nd floor, exit through the main entrance by the reception desk, and gather in the courtyard outside that entrance. In the event of a medical or fire emergency, please call 911 and notify the security agent at the reception desk. The nearest defibrillator is mounted on the steps leading from the reception desk down to Grand Avenue. Thank you, and come visit us at Portland 5.
Thank you, Ann. For our first agenda item today, we have the opportunity to hear from Metro staff and the Supportive Housing Services Oversight Committee. On the 3rd year SHS, we hear about the progress of our region has made in helping those experiencing or at risk of homelessness, as well as the challenges that still face us. We will have the opportunity to discuss the Oversight Committee's recommendations for improving the program over the upcoming year. Here with us, it's supposed to be Liam Frost, Deputy Director of Housing. Oh, you're not joining us today, Liam? All right, come on, sir. Yesenia Delgado, Supportive Housing Services Manager. Dr. Mandrill Taylor, Supportive Housing Services Oversight Committee Co-Chair. And Felicita Montablanco, Oversight Committee Member. Floor is yours. Thank you.
Good morning, everyone. Is this on? Hi, I'm Yesenia Delgado. I use she and her pronouns, and I'm the SHS manager here in Metro. Today, we are pleased to bring you an update on the 3rd annual regional SHS report that covers the period between June 2023 and July 2024. As you know, voters in the Metro region approved a historic measure designed to establish a regional homeless system of care with Clackamas, Multnomah, and Washington County. All 3 of these counties prior to the measure passage had some sort of homeless service continuum services that we have been able to build upon as we are regionalizing a homeless system of care here in the region. And one of the requirements of SHS via the Metro SHS work plan and intergovernmental agreements requires that counties submit what's called an annual report every fiscal year by October 31st. That includes an overview of their financials, how they did with the progress that they made towards their goals, an overview of racial equity, evaluation performance, and that's all combined into their annual report that gets submitted once a year to us as Metro staff and the Oversight Committee. The Oversight Committee then, with support from Metro staff, reviews and analyzes these county reports and then develops their regional annual report. And the report includes a detailed evaluation of each county's performance, consistency for their local implementation plans and other Metro SHS requirements. This report also includes our overall progress towards commitments, challenges and opportunities, and then the Oversight Committee brings this regional report along with the recommendations to enhance oversight and accountability for the following year to Metro Council and then to the 3 different Board of Commissioners across the 3 counties. So this really kicks off that roadshow that the Oversight Committee is on, sharing their findings for the previous fiscal year along with their recommendations for how things could be better. So today we're just really excited to be here sharing with you more about how SHS is transforming people's lives and really changing the trajectory that so many of these households were on, and getting them supported with the services that they needed. But also sharing more about the homeless regional system of care that we're building here in Metro, and some of the progress that we've made towards that. So the presentation today will really be led by Dr. Taylor and Felicita, and then we'll have some time for questions and answers at the very end. So thank you both for being here and all the incredible work that you've done to provide oversight for this fund over the last year. Dr. Taylor?
Yeah, I'm up first.
Yeah, go for it.
Hi, everyone. Felicita Monteblanco, she, her pronouns. So today, as Yesenia said, we're going to do an overview of who and what of SHS. Actually, next slide. I don't know. Thank you. Thank you, whoever did that. We're going to review the third year's progress and highlights. We'll also share our committee's recommendations. It's our intention, as Yesenia said, keep this quick and make more time for questions and discussion at the end. So if you have a question, write it down and save it for the end. Next slide, please. So the role of SHS, our role as Oversight Committee. So we play a key regional role in the implementation of this measure. The committee's roles and responsibilities include fiscal oversight and recommendations to Metro Council regarding the local implementation plans. On behalf of Metro Council, the committee provides independent program oversight and ensures accountability to taxpayers, service participants, and our regional community. The committee is made up of 15 leaders with diverse experience and expertise, including experience of housing instability and homelessness. One primary way the committee carries out its role is to accept and review county annual reports and then prepare a regional annual report that assesses overall performance, challenges, and outcomes of the program year. This is the first of our jurisdictional tours over the next month and a half. Like Yesenia said, we will be going on our roadshow and presenting to the other counties. Next slide, please. Metro Council is steeped in the work and very familiar with these regional goals. And as you know, these goals are the floor, not a ceiling, and we have made significant progress towards them as we end year 3. In addition to the 10-year goals, there are additional SHS goals as part of the SHS work plan. Year 3 of SHS is the first time that we have had enough information to communicate our progress on the SHS work plan goals. We'll discuss highlights for each of the goal areas later in the presentation. Next slide, please. Thank you. Key highlights of fiscal year 24. The growing pains of the first few years of implementation have been largely overcome. Counties contracted with 103 providers, including 19 culturally specific organizations, to deliver SHS services in year 3. All 3 counties made improvements to contract administration practices to reduce invoice processing. The Tri-County Planning Body, or TCPB, worked with Metro, the counties, and other partners in year 3 to develop implementation strategies for 6 regional goals. Next slide. The graphs you see here are a representation of the goals and performance for year 3. We've made progress in how we track the 5K and 10K goals, and while happy with our progress, there is room to improve in how we report towards these goals. As of year 3, SHS funded services and rent assistance supported the creation of 4,055 units of permanent supportive housing across the region. Once these units are fully leased up, they will represent a significant portion of the SHS fund's 10-year goal of connecting 5,000 households experiencing prolonged homelessness with permanent supportive housing. And almost 3,127 households were served through homeless prevention in year 3. Next slide.
All right. So Mandel Taylor, clinical addiction psychiatrist, public health physician, serving as co-chair of the Oversight Committee. So today I'm going to guide us through the financial overview of the fund for the fiscal year of 2024. And we're going to start with the revenue collection and distribution. So here is a financial snapshot, and it will set the stage for understanding how the funding strategies align with our programmatic goals and our regional priorities. So we saw robust revenue performance, and it contributed to a sustained program stability. If you see there's a revenue highlight, the distribution of the funds. So you have a breakdown by county. So really, overall, our tax collection, I think, was $309.8 million and nearly, I think, 350 million for the prior year carry over. So really kind of despite the slight dip in the collection compared to the previous year, overall revenue exceeded expectations. So that allowed us to have near full utilization of the budget. Next slide. And so here we're going to take a closer look at the spending over the first 3 years of the fund. And as you can see, the program spending doubled between year 2 and year 3, and that demonstrating a significant scale up in service capacity. And as you see here, there's an expenditure breakdown. And so the largest spending categories were short-term housing assistance, which was nearly 25% of expenditures, followed there by shelter outreach and safety programs, permanent supportive housing. The ability to effectively deploy these funds underscores both the growing service capacity and the critical need for these programs. So really kind of by prioritizing both the short-term housing assistance alongside with the long-term solutions, the Supportive Housing Services Fund can best address both the immediate crisis as well as the systemic challenges. That creates a more balanced and strategic approach to homelessness. Next slide. So now we're going to delve deeper. This slide offers a deeper look into how funds were allocated across the key programmatic areas. So in short-term housing assistance was the largest expenditure by category. It reflects the need for the immediate housing stability. And again, you can see the breakdown by counties here in the slide. But ultimately, the diverse allocation of the funds better ensures a more holistic approach. So supporting not only just one aspect or not just an emergency response, but also the infrastructure needed for long-term housing stability. Next slide. And then this last slide on our financial focus focuses on administrative costs and financial management. The SHS fund maintained an efficient administrative costs, maximizing funds available for direct services. You see here there's some degree of variability when it comes with our counties. And we can go in a little bit into detail about the different administrative rates and how that, there's some variability with counties. But really, I want you to kind of be able to walk away with here is just understanding that the efficient administration, it's a very important aspect about the fund. Keeping the administrative costs low, it helps us to channel more resources directly into housing and supportive services, but it also requires a good amount of monitoring to make sure that we're being good stewards of how those administrative costs are being utilized.
Yes, please.
Thank you. Do you have the dollar amounts that are represented by these contractors? 37 to 48% catches my eye.
Yes.
Yeah.
Is that a tiny, tiny little contract, or is that the biggest contractor? Probably not, but is it one of the top 10 biggest contractors getting that overhead rate?
Yeah, for the service provider admin rates, which is what this slide is represented, the counties provided as ranges of their service provider admin rates. So we couldn't tell you for Multnomah County which service provider that is, but we could certainly look into it and get back to you.
I gotta tell you, anything over 25% shocks me.
Mm-hmm.
I would guess that those on the larger, more
Go ahead, Councilor
significant side might be more emerging organizations who need more administrative support. But I look forward to getting more data and sharing that.
Do these numbers include the cost of technical assistance programs that we have linked up many of our emerging providers with?
I don't think so.
Yeah, so the technical service dollars that we are providing service providers. Yeah, so those dollars would be included and rolled up into this administrative rate as well.
Yeah, so that I think makes a huge difference if it's our funds that we are dispersing in order to help level up. We're essentially double counting them.
Counselor, are you referring to the program that we're developing here in the housing department, or are you referring to?
For our technical assistance grants or
This should
contracts.
not include Metro's administrative funding that is supporting our team on technical assistance and training. It should not be included in.
So you say no, but you said
I think there was misinterpretation.
misinterpretation.
Yes.
Okay, great, thank you.
I just want to add a point. It seems that there's like 11 contracts that we're listing that are above 25%. It seems that we should delve deeper into exactly what those are. I can imagine in some cases, it might be a very technical issue that requires a lot of administrative, but I think that those raise a red flag to me. And again, how much they amount for, maybe they're all small and they're very highly technical and it's justifiable in some cases, but I think we need to look at that because we shouldn't be having anything that's over 25%, probably not over 20%.
I think we're ready for the
Yeah,
next slide.
next slide.
So the SHS work plan identifies 2 goals related to, sorry, skip a slide. Housing stability, this is where we are, right? Yes. We talk a lot about the 5K and 10K goal, but a reminder, there are additional SHS goals as part of the SHS work plan, which provides a comprehensive plan for implementing the program. In the work plan, there are additional goals on areas including housing stability, equitable service delivery, and engagement and decision-making. Year 3 of SHS is the first time we've had enough information to communicate out progress on SHS goals, SHS work plan goals. The next 3 slides will provide a highlight for each of these goal areas, and you can see the full progress update in the regional report. The first goal for housing stability is housing equity is advanced by providing access to services and housing for Black, Indigenous, and people of color at greater rates than Black, Indigenous, and people of color experiencing homelessness. On this slide, we have data on the point in time count, which is the local homeless census count on a given night, showing Black, Indigenous, and people of color experiencing homelessness on the green bar, and the blue bar shows the housing placements and preventions for people of color broken by POC and non-Hispanic white. Next slide, please. The SHS work plan identifies 2 goals related to equitable service delivery. 1, increase culturally specific organization capacity with increased investments and expand organizational reach for culturally specific organizations and programs. 2, all supportive housing service providers work to build anti-racist, gender-affirming systems with regionally established culturally responsive policies, standards, and technical assistance. This slide provides an overview of the number of culturally specific providers and value of their contracts for the first 3 years of SHS. As a region, we have seen an increase in culturally specific investments. Next slide. The SHS work plan identifies 2 goals related to engagement and decision-making. 1, Black, Indigenous, and people of color are overrepresented on all decision-making and advisory bodies. 2, Black, Indigenous, and people of color and people with lived experience are engaged disproportionately to inform program design and decision-making. This slide here provides an overview of the people of color and lived experience representation in the advisory bodies of the counties. Next slide.
Okay, so key challenges. So as we transition into this next phase with the implementation, there's several critical challenges that need to be addressed to just ensure that we're building a stable and sustainable regional system of care. So first, the growing need. So despite the significant progress that we've made with housing placement and homelessness prevention, there are broader systemic factors and they continue to push more into homelessness. Just as a data insight, for every 10 households exiting homelessness into permanent housing, there are 15 new households entering the system in year 3. The number of households needing permanent supportive housing has increased by over 20% since the launching. So even with thousands already having been housed, the need for eviction prevention services is rising, particularly since pandemic era federal assistance has been diminishing. There's also competing priorities. There's balancing resource allocations. It's critical and meeting the goals and advancing. So the program has been facing these choices. There's eviction prevention services to keep people housed. There's emergency shelter expansion to manage those immediate needs. And there's permanent supportive housing investments to create long-term solution and trying to find what is the appropriate balance. So there really is no single entity that's responsible for compiling and analyzing the comprehensive data with our system needs and gaps. So that has been limiting our ability to make fully informed decisions, which is also going to be part of the recommendations. But financial oversight. So while financial reporting has improved, there's still these critical gaps that remain with our tracking of expenditures with population A and population B, which we are actively working on. The progress is that, Metro has developed a financial reporting template. We are meeting with counties. We met with counties very recently, as of last week, actively, trying to best ensure that we have a cohesive system of care. So the ongoing issues are there's still some degree of inconsistencies in methodology and definitions. We are continuing to meet, and we're getting closer and closer to having fuller cohesion with that. Regional evaluations. So an effective regional evaluation that is impacting the fund's impact requires, I guess, really like kind of consistent methodology, clear metrics. So the challenges. So jurisdictions don't always share the consistent interpretation of key concepts in the work plan. There's differences with annual equity analysis methods, and that has made it traditionally some degree of difficulty. Again, they're being identified. We're working towards that. There's regional outcome metrics with the work plan. And trying to ensure that we have a clear methodology for measuring the progress with the goals that we already have in place. So we're establishing evaluation framework. We're continuing to do that. And that is, it's part of the challenge, but it's also been part of our ongoing solution. Next slide. So our committee has been deeply engaged in guiding this program since its inception. Last year, as an oversight body, we issued a comprehensive set of recommendations aimed at enhancing efficiency, equity, and sustainability. So with that in mind, we're going to ask that you try to maintain a multi-year focus when thinking about these recommendations. Our recommendations are designed as a multi-year initiative. It reflects the complexity needed to build a robust and resilient regional system of care. And we're also going to ask that you maintain a collaborative mindset. So while Metro leads the coordination with these recommendations, the success of implementation requires active engagements with counties, service providers, and the Tri-County Planning Body. So this year, our recommendations focus on several critical issues that will significantly influence the fund's long-term success. The recommendations aren't just an immediate fix, they are strategic initiatives. So next slide. Consistent and transparent data. It's crucial for accountability to voters and for evaluating success in the program. So urgent collaboration, that's something that's needed to address ongoing challenges. So that means programmatic and financial data alignment, operational definitions, standardizing definitions utilized. So like I mentioned before, POP A, POP B, permanent supportive housing. These are initiatives that are in the works, but they will continue to be in the works. But it's also just making sure that you understand the importance of it, the value of it, and the progress that's actively being made with that evaluation framework, like I mentioned beforehand, and just some methodology updates, making sure that you have a consistent approach with measuring progress. Next slide. Nonprofit and community-based organizations are central to the success of this fund. Particularly small, emerging, culturally specific providers. Engagement and planning. So involving the providers as full partners, planning, decision-making process, just ensuring that the system that you're building serves the population that needs to be served. Developing regional strategies, providing equitable, livable wages. So supportive strategies for providers, keeping that in mind. Providers aren't just implementing policy. They are really the lifeline of communities. By ensuring their financial stability and engaging them as partners, we can strengthen the entire ecosystem of support for those experiencing or those at risk of homelessness. Next slide. And regional priorities. Yeah. Collaborative decision-making. You have the SHS fund has significantly expanded resources for homelessness, but resources alone, they're not going to be sufficient. We need to ensure that we're being strategic with things. Metro Council, it's just kind of ensuring that you lead a process to understand the importance of, like I mentioned before, and having clear regional priorities, ensuring that we're having strategic use of resources, making sure that the decisions that are being made are based on the data that's there. There's a bit of a balancing act when these decisions are made between balancing investments, but and just understanding that balance between prevention, shelter, and permanent housing. And the best of our ability is making sure that the decisions that you're making are inclusive, and ensuring that, when these decisions are being made, that the people who know, that space best are part of the conversation. Next slide.
Another recommendation centers oversight and accountability. This includes performance monitoring, evaluation, and reviewing compliance on a regular basis. Data and updates from these oversight activities should be provided to the Oversight Committee and Metro Council so they have the necessary information to operationalize their charge. Metro should have mechanisms to take corrective action as needed based on its performance monitoring to ensure regional accountability to the goals and commitments in the SHS work plan. Next slide. Improved decision-making is particularly needed in relation to the development and implementation of regional definitions and standards, as well as reporting and monitoring tools and requirements. This may require a reassessment of the decision-making and reporting processes laid out in the county's intergovernmental agreements with Metro, and potential updates to these processes to support more effective decision-making and oversight moving forward. This reassessment should be a priority and should happen in the near term. Effective regional coordination must be rooted in mutual trust and respect between Metro and the counties. The clarification of the decision-making processes should include a shared commitment to dialogue and mutual listening to facilitate those relationships. The Oversight Committee recommends that collaborative efforts to shape the process and requirements of the SHS measure are consistently used. The committee requests that a framework for decision-making be agreed upon by the counties and Metro, with a process that ensures the committee itself can enact decisional authority on key topics related to the oversight of the SHS fund. Last slide. Metro and the counties, we want to share a story, close with a story from the report. Metro and the counties have shared many moving stories of community members supported by SHS funded programs like Nicole in Washington County. Nicole is a survivor of domestic violence and human trafficking from a young age. Originally from Eugene, she came to Portland with some friends who left her stranded. She stayed at a women's shelter for about 3 months before connecting with Washington County's SHS funded rapid rehousing program. From there, it was only a week between getting her first call from her caseworker, Amanda, with the Urban League, and moving into her new home in Beaverton. At age 34, Nicole is living alone for the first time in her life. It means more than life itself, she explains. The program has done more for me than people will ever know. The apartment is more peaceful than other places she's lived, many of which weren't in a good neighborhood or environment. The apartment windows look onto a little creek, and Nicole finds the water relaxing. Home finally feels like a sanctuary. Once I close the door, everything out there is out there, and it's not here. Amanda helps with necessities like furniture and food boxes, along with providing support and encouragement. It's easy to feel like a statistic, but Amanda makes you more than a statistic. She makes you a success story and goes above and beyond to do so. Now that Nicole has a safe place to live, she's able to process and heal from a lifetime of trauma and living in survival mode. She plans to go back to school and ultimately would like to start a nonprofit to help other people who have experienced domestic violence and human trafficking. She wants to provide hope and a way out. She wants to be a light like Amanda has been for her. Stories like Nicole's demonstrates the transformational power of our region's commitment to invest and services that help people exit homelessness and transition into stable housing. And that is the end of our presentation.
Thank you, counselors. Is there any questions or discussion? Can go first. No, Counselor Wong and Counselor Gonzalez.
Okay, thank you, Deputy President. Great to see you all. Thanks for the presentation. I'm going to start with a big picture question. I think it was the recommendations, I think Dr. Taylor, you talked about competing priorities and growing need. And as we kind of look forward to the next couple of years and hopefully, further into the future, I'm wondering if we have like a well-developed like theory of change of like what do we hope to accomplish with the resources we have so that the expense or the growing need doesn't continue to go up. And what I'm saying is I think we're putting a lot of folks that need it onto long-term rental assistance, but we know that the problem keeps growing. So what is the pathway that we should be taking to I guess reduce that trajectory? Because I think we're all dealing with scarce resources now, and it feels like on this path, without some sort of intentional intervention, the scarcity of resources will continue to become more scarce. If that makes sense. It's probably $1 million question, but or $1 billion question.
No, I mean, you're talking about, systemic factors which, kind of go above the program that we have to take into consideration the changing landscape. I might pause. I might bring Metro in before I give editorials for things, but I think that is something that we have had conversations about in the past. There's some degree of collaboration that we need to start thinking kind of beyond. There's this voter initiative, but there's other sources of funds, but there's also making sure that we're paying attention to the drivers of that too, and making sure that we keep our eye on the ball to what's the cause of this changing landscape. So I think partly for the program itself, but maybe even for greater metro area to think about, whenever we think about the problem, we should also at the same time think about the drivers to those problems and create a solution that not only addresses that problem, but also addresses what perhaps might be causing those problems.
In pages and pages of data, the one statistic that stands out most to me is, I hope I get this right, is that every time like 10 households are housed, there's 15 in line. So there's an input that it's so overwhelming, and amazing work is happening. I mean, I hope that's clear in our presentation that profound work is happening across the region and the need is getting greater and greater.
I might add something to Councillor for the record, Liam Frost, Deputy Director, Housing Department, he, him, his pronouns. We think about SHS and talk about SHS a lot. It is a complex, sprawling, still relatively new initiative that's being rolled out in the Tri-County region. And yet it is still one piece of this picture that you just painted. And when SHS was initially envisioned and convened, it was intended to operate and leverage other parts of the housing continuum. So to the point that Dr. Taylor and Felicita just made, I think it's important to clarify what our role is as the Housing Department in Metro, what our cousins at the Planning Department's role is, what the state of Oregon's role is, and how we can be good partners with those folks. For example, I'm really encouraged by Governor Kotek's announcement to encourage development of middle housing. That's not something that SHS does, but it's definitely something we need to be connected to, because without that housing supply, we are going to see that 10 to 15 ratio continue. And then in terms of theory of change, I'd say it's from my point of view, pretty challenging right now, given that these rumors about the cuts to HUD they seem less like rumors and seem more like impending cuts. And so I think one of the key priorities for us as a housing department is to remain responsive to need, flexible and nimble, and then to work towards one of the council's 3 strategic priorities, which is housing for all. And that brings our partners back into it again.
Yeah. In this fiscal year, and thanks for that, Liam. So I think the county's received $306 million. And I think you had said something around like that doesn't cover the true scale of need with SHS on all the other resources out there. If you had a magic wand, do you have a sense of what that scale actually is? Like, do we need twice as much, 3 times? Like, and I understand that like folks experience helplessness. This is like a symptom of systemic issues, and we're trying to like serve that population in a specific way. So I think there's, systemic issues that, are more kind of the cause, but yeah, what is the actual scale of resource need?
Yeah, I mean, I think what I could offer, it's a challenging question with a really nuanced answer, which really comes down to like, what are we trying to solve for? Like homelessness, like we've been with this fund really intentional around population A and B, and it's pretty robust and covers a lot of different experiences of homelessness, but the scale for homelessness still continues to be broader. For example, if you look at grade school data, it shows that 10% of students are transient and moving from one school to another, which implies that a lot of these, like 10% of the families in schools are experiencing homelessness. That, however, is not visible homelessness in the same way that we are seeing it and addressing in population A. So when we talk about solving homelessness for everyone in our community, it really would come down to like, who are we solving it for? And if it's for everyone, then it really requires a much more robust look at the data and numbers than we've ever done in a much more intentional way. So, yeah.
No, I would agree with that. I mean, that goes back a little bit to the systemic drivers of things, meaning that, well, some people in that population, maybe it's mental health, maybe some of it's addiction. So the outcome is the homelessness, but people have different pipelines how they get that. So making sure that we have aggregated data to ensure that we know where the directions are coming from. Then from there, you work backwards, and then you can develop a more strategic plan versus just one fell swoop of homelessness as a problem. So again, probably I'll throw the vote in again for thinking about what's driving certain subpopulations to find themselves into homelessness.
And I appreciate your provocative question about what's the magic number to solve the need. I think one very short thing I'd say is that you've heard the counties after coming to terms with a decreased revenue forecast that they are going to rebase their revenue. I'd like to see some rebasing around, well, which programs are effective, how can we encourage the adoption of those programs across the 3 counties and different nonprofit service providers. And I think with the data sharing agreement, we're going to have some information where we can really do the work that we need to do as a housing department, and that's evaluate the effectiveness of these programs, which will then help us understand, well, the cost per exit of homelessness is this much or this range. Right now, I just don't think we have enough information to get to that.
Yeah, thanks, Rob. I mean, if I were thinking of a theory of change, like I would just challenge our agency to like think about all the levers that we might have, because I think it's much more expensive to exit someone from homelessness than to prevent that in the first place, and that's systemically, right? And I think that's like housing, that's like education, that's economic development, and we do touch upon those. So I just, I understand you all are doing your specific role in administering SHS, but I think for us, maybe on the council is like, what is that broader picture that actually reduces the circumstances where people enter homelessness in the first place? And that's really a theory of change and frame that I'd like to think more about, because I think what we're seeing is systemically more people are entering homelessness, and it's costs more and more to exit. So like we are kind of, and I hate that term, but like doom loop spiral, like if we're not thoughtful, that also applies here. but, yeah, I think we'll just leave it at that, but thank you for the oversight and all the recommendations. They make a lot of sense.
Thank you, Counselor Wong. Counselor Gonzalez, did you have your hand up? Or you?
Yes, I did. Thank
All right.
you. I must have put it down by accident, but I just want to start off first with some appreciation for our committee members for coming today. You have both very demanding professions and community commitments, and on top of that, raising your hand and wanting to be a part of and rolling up your sleeves, might I add too, to support this regional program, not only getting off the ground, but the continued need for alignment. And you know, as I read the report, and I think Councilor Wong opened the conversation really well, because there is a lot of conversation, I think, happening, as we know, outside these halls around that theory of change and our North Star. And also, I mean, an opportunity as we're approaching the midpoint of this program, and our commitment to voters to really recommit to the mission and to our purpose and to the work that we're doing. And so I see in this report like a really direct acknowledgement and like a spelling out of some of those tensions. And I really appreciate the boldness that goes into that. There were like 3 parts in particular that I underlined that I want to call out, and then I just will ask a really high level question, and I'm curious to see how the council continues to for the conversation to keep going. But there was one line on a section for competing priorities, and this sentence was in bold, so I know it was like an attention grabber, but no entity is currently responsible for compiling and analyzing the information, making it difficult to get a full picture of the overall system needs and gaps as it relates to our resource allocation and strategies. Yeah, that's huge. That's a huge thing to put in a report. I want to call that out. And I think that's a question that many of us have been asking as well of our own staff and of the regional system. And so thank you for calling that question. Also, another really important sentence, key gaps remain that undermine the committee's ability to provide effective oversight in the SHS fund. It's a really important thing. And also I mentioned that as the program evolves, the need to center trust and collaboration, but also an explicit call out for a reassessment of IGAs to support decision-making clarification. So anyway, I just thought those like were really pointed recommendations and feedback, which on a lot of levels is saying like, hey, elected leader, decision makers, governments, like let's get to the table and work on how we on not just what we do, but how we do it. So I wanna acknowledge that. So I felt like those things made an impact on me, so I wanted to just vocalize them and verbalize them. And as we kind of like weigh with this question of theory of change and the data points that have been shared, which are super eye-opening, and you know, the 10 and the 15 number, but we know that it's like you add a few extra zeros, right? And that's like the real number of folks in the thousands that are exiting and entering each year. The scale of human struggle and suffering is super is important for us to put at the center. So I want to ask a really high level question here, but we're 3-4 years in, approaching the midpoint. How confident are you feeling that this program is on track to reach our targeted spending of population A and population B from the oversight position that you're in? By year 10 or by year, what year do you think we might get there?
It's complicated for a couple of reasons. What exact year? I don't know if I'll be able to nail that down. Will we get to the goals that we set? We will, but will that ultimately meet the growing need if we don't have a more expansive way of tackling the problem. So it's like a yes and sort of response that I'm going to give you with that one. But others may feel differently.
Yeah, I mean, I think that was great, Dr. Taylor. I think the other piece that I would like to uplift that I think we've talked about here in council meetings before is that there has been lack of consistent data that the Oversight Committee and Metro staff has had in reporting towards that. And I want to give major kudos to the Oversight Committee members, especially our co-chairs who have taken it upon themselves to like bring together the 4 jurisdictions and say, we need to figure out this data collection issue out so that we have the most reliable data to see where we're at with the 75-25 split. I feel really confident that with some of the system improvement changes that we're making with the data sharing agreement working to be finalized, we will have better and more applicable data to be able to report effective progress on that 75-25 split. But yeah, so just thank you, Dr. Taylor and Felicita and others who have seen this as a core requirement of the measure and are working and really intentionally to ensure that we have the data to be able to report on it so that we can answer questions like yours.
Can I just add that?
Of course, please.
Yes, and all that. We are seeing an increase in our providers' ability to do this work and respond. And that investment, that the technical assistance, all these little pieces are helping the providers because we can't do this work. We don't do this work well. We don't have trust, right? And so I feel good and I'm excited and we're gonna reach our goals.
Yeah, all right, excellent. I love that. You know, I think also in the you know, approaching this from the spirit of yesterday where in Hillsborough, we were able to break ground on the first permanent shelter in the history of the city of Hillsborough. It's a huge moment for the region and for Washington County. I was just really sitting and centering myself because the city of Hillsborough turns 175 this year. And so that's a huge deal to think about how there was in one of the first reports that county officials submitted to Metro on SHS. There was a line in that report that shared like for decades, the approach of cities has been to buy a max ticket for folks to go buy services or to go get services in Portland. And with this measure, being able to demonstrate that we're shifting that. And I think there's so many excellent success stories, despite like some of the very hard truths and that we need to work on and address. You know, Washington County essentially ending unsheltered home or largely ending unsheltered camps on the west side is a huge deal. Things that we should be able to scream from the mountaintop and sing from the mountaintop that this measure is working. And also with the tension of, you know, we still have like more than 5,000 or 6,000 people sleeping outside on any given night in the region. So there's these tensions and these truths that we have to balance. And I completely agree that if we are able as a council and as an agency and as regional partners to work on the recommendations that you've so diligently prepared and presented us, then we can reach those goals. So thank you for locking arms with us on this and for your leadership. And I just wanted to wrap up there and hand it off to my peers.
All right, next up we have Councilor Lewis. Councilor Rosenthal, did you drop your hand?
Yes, I did.
Okay, and then Councilor Nolan.
Sure, thank you so much. Want to start with a big thanks to the two of you and to all of the fellow committee members. I believe that y'all put in more time than any other body with Metro. And I say that understanding the workload of our friends who are on JPAC and MPAC, but your meetings are longer and you have more frequent meetings. And in particular, the run up to transmitting this letter and report, you are meeting every other week. So that's a huge lift, and I think we need to recognize the depth that y'all get into in the meetings. So thank you for the work. In reading the letter, obviously, recommendations are in the same basic planks or buckets as in previous years. So we're in year 3. Many of the previous recommendations, the ball has barely moved. So when you speak to oversight and accountability, you can't speak for the whole committee because it's pretty general. What would each of you do differently in terms of equipping the committee with tools to move things along? You see glaring holes, you see giant red. What do you want to be able to do as a committee in terms of correcting, rectifying, moving Metro or our jurisdictional partners towards resolution on these items?
I feel like where I've been the broken record in the committee meetings is that the oversight committee doesn't have much authority. I mean, even our report is 6-8 months after it ends, right? And this takes time. I want to acknowledge
And this was
that.
faster than the previous too.
Yes, yes. And so I think where I really struggle individually is how we get results, we get data, we have deep discussions, and there's so much expertise on our committee, my goodness, and so much perspective, and there's the accountability is limited from our role. And I don't have a magic wand idea, but what I've consistently said is I wish we had more teeth so that we could, when we're having conversations about things that are upsetting us or frustrating us, that there's some accountability to that.
That is fair. That is something that has come up quite frequently in our committee. We're oversight, so we're very good at picking things out and highlighting what needs to be improved and glaring issues. We've had conversations of what would a reimagining of the IGA, what would that look like? In thinking about the role of our committee, but essentially wanted to ensure that there is more accountability for things moving forward. What that looks like. It's tough. I don't have a clear answer for what that looks like. I will point out, like I said beforehand, when we do reimagine what our agreements are, with Metro and the counties, thinking about that role of oversight and thinking about how much of a priority that needs to be when it comes to proper utilization of funds, but also strategic ones. I would think about it on that level. I don't know how oversight, aside from having more, some degree of, you can certainly have electorates and those sort of things. You could have more people on the committee who aren't necessarily neutral, who may have a quicker lever of change, but that comes at a sacrifice when you do that. And so if you really want to maintain that being a value of that neutrality, you may want to thinking about reimagining it at that IGA level.
Mm-hmm.
Thank you.
Councilor Nolan?
No, as often is the case, Councilor Lewis beat me to my.
She's good. Any further discussion? Okay, seeing none, I want to thank you, Dr. Taylor, Felicita, Yesenia, and Liam for the report out. I know countless hours you all are putting in on making sure that we do our due diligence in delivering what the voters asked us to do. And so thank you. And I really appreciate you coming out here to make time with us today. So thank you.
Thank you.
Thank you. Thank you.
Thanks, y'all.
Right. Next on our agenda item is something this council has been looking forward to for quite some time. This region has been in dire need of improvements and better transit along 82nd Avenue for decades. The corridor serves as a commuting thoroughfare, a commercial corridor, and a place where small businesses can thrive. It is home to the most popular bus route in the region. Today, staff will share with us the preferred plan for transit improvements on 82nd Avenue that reflect the input of the community throughout a long, thoughtful engagement process. Here with us are Kelly Betteridge from Investment Asset Managers, Melissa Ashba from a Senior Transportation Planner, and Brian Harper, Principal Planner, Regional Planner here at Metro. Thank you.
Thank you so much for having us. All right. So my name is Melissa Ashbaugh. I'm a Senior Transportation Planner at Metro and Metro's Project Manager for the 82nd Avenue Transit Project. I'm joined by Kelly Betteridge and Brian Harper, and today we will be giving you all an update on the 82nd Avenue Transit Project. Next slide, please. And just to give you a preview of what we will go through today, I'm going to spend a good amount of time on the project overview so that you understand what this project is, what we're doing, and why. Then give you our main update of today, the locally preferred alternative, which was recommended by our steering committee last month, and a few next steps for council to be aware of. Next slide. All right, and I'm going to start with the project overview, but before I do, I'll have Kelly give us a little orientation to some other projects that are on a similar timeline. Next slide.
Thanks, Melissa. Good morning, Kelly Betteridge, Investment Areas Manager here at Metro, she, her pronouns. I mainly wanted to remind everyone that this project, of course, is a regional priority. And we are very fortunate in that in the last 3 months, we have had 3 of the top tier projects from the high capacity transit project arrive at a locally preferred alternative. So today we're going to talk about 82nd Avenue, but in the not so distant future, you'll also hear an update about TV Highway as well as the Montgomery Park streetcar. So it's been an exciting time and a lot of forward momentum on locally preferred alternatives for transit investments. Back to you, Melissa.
All right, next slide, please. So I think it's helpful for me at least to just get oriented to the timeline to start. So what we've done and what's coming. The planning process began for this project officially in 2022 with the formation of our steering committee. That's gone on through last month with our steering committee selection of the locally preferred alternative. And I'm going to be talking about the locally preferred alternative a lot today. In this region, it's how we demonstrate consensus on a project at a high level, so it's a big milestone for us. We're here today to present to council on that locally preferred alternative, and we'll be returning in June with a request for Metro Council to endorse our locally preferred alternative. At the same time, we're moving from planning into design, so figuring out more specifically how this project fits within the roadway. That process will continue through 2027, at which point we'll have all of our funding committed and are anticipating moving into construction to open in 2029, open this bus rapid transit project. Next slide, please. So what is this project and where is this project? It's primarily located along 82nd Avenue, which is a crucial arterial. It crosses the jurisdictions of Clackamas County in the south and Multnomah County in the city of Portland in the north. And what this project would do is upgrade transit service on a portion of TriMet's current Line 72 bus line. And it would upgrade it to Frequent Express or FX Bus Rapid Transit. This is a higher capacity, more frequent service. It's the second of its kind for TriMet, the first being FX2, which you might have seen on Division, those longer green bendy buses that move faster through congested intersections. Next slide, please. And so why 82nd? I think these pictures help tell some of that story, particularly that left one where you can see the bus stop right there next to some unconnected sidewalk. 82nd Avenue is a place that has suffered from underinvestment. And it's also a corridor that has been long identified as a priority for major transit investment. As Kelly mentioned, it's in our regional high capacity transit plan as a tier 1 or top tier priority. It's in our regional transportation plan and it's in our regional transit strategy. It's also a corridor that right now is getting a lot of attention after years of community advocacy, ODOT transferred ownership of the portion of 82nd within, most of the portion of 82nd within the city of Portland to the city in 2022. And both the city and ODOT are currently in the process of tackling a huge backlog in maintaining the road and addressing critical safety and maintenance needs. Early estimates of the needs for just that work, I think, were over $1 billion. And so while that work is underway, it's a really exciting opportunity for us to plan holistically with those investments, to bring transit to a place that is identified in our plans and has been identified as a community for this type of investment. It's also an opportunity to leverage local funds to bring in federal dollars. We are anticipating or seeking a capital investments grant from the federal government, which would, we're seeking about $149.9 million through that grant. Next slide, please. And so we're upgrading a portion of line 72. Looking at line 72, lots of other indicators, I think that it really makes sense as a place to be investing. So line 72 is TriMet's highest ridership bus line. It's the highest ridership bus line in the state. It connects to over 20 other bus lines, the MAX blue, green, and red lines, and many key destinations along 82nd Avenue. It's also one of the TriMet lines that after the pandemic, ridership rebounded much more quickly than other lines, which is a signal that people were really using it to get where they needed to go for their essential services, that they're relying on this route. At the same time, line 72 has the highest passenger travel delay of all TriMet lines. In the afternoon peak rush hour, 1 in 4 buses is late. Existing bus stops are spaced very close together and don't meet current TriMet standards. And most of bus stops lack shelters, seating, crosswalks, lighting, and real-time information, the kinds of things that make transit more pleasant and welcoming to ride and also bring in more riders. Next slide, please. And then some more background on the communities who are living and working and playing along this corridor. Population and employment in the corridor are high and growing. There are around 68,000 people who live within a half mile of the proposed route, or 4% of our region. There are around 30,000 jobs, and it has the type of population density and mixed uses to support this kind of high capacity frequent service. The corridor also includes populations that are more likely to rely on transit than the general population, and has many institutions and social services, just a few examples being Portland Community College, McDaniel High School, Clackamas Service Center, and the Montevilla Community Center. Next slide, please. And so last bit of background for me, I think a lot of great reasons to be focusing on this area for transit investment. And because of that, Metro Council, you all established the steering committee for the 82nd Avenue Transit Project in June of 2022. And this steering committee has really led us to the locally preferred alternative. It includes 8 agencies and 4 community-based representatives, and was chaired by Councilors Lewis and Councilor Wong. And together, the committee was charged with recommending a locally preferred alternative, which again is how we establish regional consensus on the basic parameters of a project. In particular, for a transit project, it's how we define the mode, the general station locations, and the route. In addition, we had several staff level committees, as well as really ongoing public engagement. So online open houses, surveys, in-person open houses, focus groups, attendance at meetings at neighborhood associations, and other more targeted community outreach groups to inform the locally preferred alternative recommendation. And so with that, that's kind of the background on the project and how we got there. Before I get into our major update, the locally preferred alternative, I'm going to turn it over to Brian Harper to talk about a parallel effort that is very related and important to thinking about the work that's happening on 82nd.
Thanks, Melissa. Appreciate it. Councilors, good to see you today. Brian Harper. I'm the project manager for the Equitable Development work along 82nd, and I work in the Community Investments Group. You can go to the next slide, please. Little background, as Melissa stated, this is a parallel effort. These equitable development strategies are community-led planning efforts that run in parallel with the transit project and the transit planning work. And I think just a quick bit of background on why that is something we do is we can go back to the Division Transit project to see as that project was progressing through the planning stages for the transit. What community was very vocal about was that the issues that were most important to them were ancillary to the actual building of a transit line. It was housing related, it was displacement, it was gentrification, it was market pressures that were really worrying them. And a lot of the idea of a transit line was a very positive one for them. It was also something that brought a lot of uncertainty because it brought potential for rising values. And so there was a lot of concern about that. And at the time, and still today, there's not a good way to address a lot of those concerns in a federalized sort of like transit planning process we go through to get ourselves in a position to be competitive for funding dollars for those transit projects. So what we learned from that is we really need to have a different type of conversation in parallel with community about these things, because these pressures are not going to go away and they're not changing in our region. So our first real attempt at that was the Southwest Corridor work, which is still ongoing and has been very successful in terms of building a coalition of community partners that are working for better outcomes for themselves. That work has also happened on TV Highway, but here on 82nd Avenue, we've been able to work with four main nonprofit partners to represent community: Oregon Walks, Verde, Apano, and Unite Oregon. And the idea being that we help convene this space, an opportunity for them to have discussions about what is the most important factors that they need to address within their communities and along this corridor to stabilize households and businesses ahead of the market pressures that are occurring now and the ones that will potentially come as we make more investment. And as I think Melissa alluded to earlier, there's a ton of investment coming into this corridor right now. It goes beyond just the jurisdictional transfer. It is investment by the city of Portland in the streetscape. It is a TIF district that has come online. There is a lot of money that's going to come into this corridor. And there are a lot of concerns from community that investment will only make it harder to stay for those that are most vulnerable to potential displacement purposes. So this process has wrapped up in terms of a strategy that the community has developed for themselves. And that equitable development strategy is available now, and they are using it as their guide for implementation. And the next step for them is figuring out how to implement the items on that list and working with the correct partners. A lot of these items, some of these items are things that are already underway or that other partners have committed to. And some of these items are things that have not been committed to yet and not started. And so the idea is to work with the correct partners collaboratively to identify the funding needed or the steps that need to be taken to address these issues moving forward. And so in that sense, the coalition is taking the next step. It's been very successful, and we are continuing to support them as much as we can on our end. Next slide. This is just to give you a taste of sort of where they landed. These are community priorities, the major categories of the equitable development strategy. I'm not going to take the time today to dive into these in detail, but I will say that report can be made available to you and will be made available to you so you can see where the specifics are within these categories. These categories are very similar to what we see in other corridors, but not the same. And I think that's a really critical thing to remember, is that each corridor and each of these communities have different priorities. And so this is why it's so important to work with them at this level to figure out what's most important there. And that concludes what I have, and I'm happy to answer questions when the time is right.
Thank you, Brian. Next slide, please. All right, now into our locally preferred alternative, our big update. Next slide. I think it's really deceptively simple, but is the result of really years of hard work, hard conversations, technical analysis, public outreach. So this is in your packet as well, that map, if you want to take a closer look. The steering committee selected a recommended locally preferred alternative last month on the 16th. It defines the mode for this project, that it is a frequent express or FX bus rapid transit. The general station locations, which are about 1/3 of a mile on average apart, and you can see in that map. And the alignment or route, that this is going to be a 10-mile route between Clackamas Town Center Transit Center in the south and the Cully Boulevard and Killingsworth Street area in the north. Next slide, please. And so what is this transit project going to bring? It's going to have 68 stations with all of our pickup locations having upgrades, including weather protection, seating, real-time information, and lighting. There will be enhanced crossings at every station location. We'll have sidewalk, curb ramp, and accessibility improvements. We'll have new signals, signal upgrades, and other improvements. And those are really important tools for us to be able to speed up the bus through congested intersections. We'll have roadway improvements and repaving at station areas, higher capacity hydrogen electric articulated buses. So the longer green bendy buses that are going to be zero emissions vehicles. And we're also having continuing discussions around physical priority through business exit and transit lanes. That's another tool we can use to speed up the bus, with some decisions on that physical priority expected this summer. Next slide, please. And so some next steps for you all to be aware of. Next slide. So our steering committee has recommended that locally preferred alternative. Our jurisdictional partners are right now going through their own LPA endorsement processes. We're here today to introduce the LPA to you all, and then we'll be returning in June once those local endorsements are complete to request that Metro Council endorse the locally preferred alternative by resolution. In June, we're also likely coming back with a request to endorse the equitable development strategy as well. Next slide, please. And so with that, I have a question for you all if there's more information that you need on the LPA or the project before we return in the spring with that request to endorse the LPA, and also want to open it up to counselors for any questions you have for our team.
Thank you so much for that. And I want to first of all thank Councilors Wong and Councilors Lewis for their leadership on this committee and on this corridor. It's one I can remember many moons ago. We started this work with Brian when I was on the other side of the fence, and so it's really a good place to be to see the LPA, but also to know that I remember the first conversations Brian and I had about this around the thoughtfulness and being careful around community, and it looks like y'all have applied that and it's showing. So thank you. With that, I want to open it up to my colleagues for any questions or comments you have for the committee or the group here. Go ahead, Councilor Wong.
Great, thank you. Gosh, well, I think I've been part of a committee, so I don't really have any additional questions, but just a heartfelt thanks to all the staff from all the agencies that worked on this. I think we can sense a lot of political support from agencies all across the region, and it was a really smooth process. I think, we did multiple rounds of temperature checks and voting, and I think we had maybe 2 yellow cards the whole time. Otherwise, there was this broad agreement between, community folks, governments, TriMet, on how important, how impactful this project will be. And also, I think a lot of partners are also putting in resources. So I want to thank the City of Portland for their $55 million from the Portland Clean Energy Fund to support the project and also support workforce development. We also have that TIF district that Brian mentioned, so $460 million in the TIF district, with at least 40% of that going to affordable housing. So a lot of the, I think, financial tools are there. We have a lot of our, a good chunk of our local match there, and hopefully, the federal administration will come around eventually. But yeah, thank you for, all that planning, all the community engagement, and also taking in all the lessons learned from division. So I think we've really, advanced as agencies in how we do this planning, with community in the lead. So yeah, I'm excited to vote yes on this in June. Thanks.
Thank you. Councilors Lewis, Gonzalez, and then Rosenthal.
Sure, thank you so much. And I really want to lift up the leadership of my colleague and co-chair, Counselor Wong, who has been working to uplift this project and this process in all the hats that he wears. So really valuable leadership from him. It's been an honor to get to co-chair alongside you. The thing that's most important, I think, is the equitable development strategies aren't strategies, they're funding asks. And while we feel really as secure as can be in a collapsing economy about the future of the project itself, every single strategy laid out in the document has giant question marks next to it. I want to pat my own self on the back for bringing the legislature in. It's not normally a component or a dimension of putting together a steering committee. And I think we lucked out with the right member at the right time. But I do believe that in order for the project to be successful, the funding asked for equitable development will need partnership from the local and the state. Probably the time is not ripe for this session, but we need to be looking at 2 years from now. And that feels really critical in this moment to recognize. The other thing is a little bit of a retrospective. We kind of knew one terminus at the start of this. We knew Clackamas Town Center. We did not know the community on the northern end. And the ease at which we made that decision as a steering committee and as political leaders and frankly community leaders was only because of a lot of good community engagement that TriMet was frontline for. And I really want to underscore the importance of how functional that moment in time was for the relationship between TriMet and Metro. I think in other parts of this planning work, it gets more convoluted, complicated, and political. But in that moment, TriMet was able to be on the ground, hear from the communities, so we could make that decision. So thank TriMet as a partner in particular for that work. Yeah, we have to get the shovels in the ground. Yeah, we have to do it. But we've hit the milestone moment from our agency's perspective. And thank you to the team in front of us today.
Okay, Councilor Gonzalez and then Councilor Rosenthal.
Yeah, wow. Well, Counselor Lewis and Counselor Wong, thank you so much for your amazing leadership on this project. I mean, I think from the JPAC perspective as well, this has been one of our top priorities, and we're working on some things with a regional flexible fund bond and continue to center this as one of the main centerpieces in that. And so I love seeing the high level of support from all of the regional partners at that table and across the state. Frankly, this is I think a project that hopefully symbolizes the future of what our region can be doing more often, not only with the steel and buses, but with the community development and empowerment. So actually kind of like a fun technical question just to ask. So what percentage of like the project is in Clackamas County versus Multnomah County? I'm so curious.
About 20% is in Clackamas County and 80 within the city.
Cool. I love that you have that number like at top of mind.
A little
Great.
less, right?
It's like 18. Yeah, I'm rounding up.
Yeah, a little rounding. And as my peer to my right here and I we're working on a similarly wonderful project and looking through the local partners contributing and everything like that. All local partners are contributing in their local match as well. How's that going?
The funding plan for 82nd is a bit different than it is for TV Highway. And so all of the partners are supportive and at the table, but from a funding perspective, not all partners are contributing.
Okay. All right. Can I ask more about that? Sorry, I just want to.
Sure.
Can you tell me what partners are and what partners aren't?
Oh, sure. Well, I guess there's lots of different ways to think about contribution, right? So there's cash contribution, but there's also staff time. And so from a staff time perspective, all partners are contributing. And so everyone's at the table doing the work, attending the meetings, helping us to review the designs and such. From a dollars perspective, the major funding partners are the region with some regional dollars, as well as the city of Portland, as well as TriMet. And those are the main funding partners.
Sweet, thank you. Great. I just thought I wanted to ask, since I know that we're working on that in other areas. But again, I just want to celebrate the hard work, and can't wait for us to get the shovel on the ground, like Councilor Lewis mentioned, and get this project delivered to people.
Absolutely.
Thank you, Councilor Gonzalez. Councilor Rosenthal.
Thank you, Deputy Chair. First of all, kudos to all the people both on the staff as well as leadership for moving this project forward, and I'm glad to see it's going forward. My question is, I noticed in the community priorities, safety was not listed. Now, that's something that's a very high priority out in TV Highway, so I'm curious about that.
How do I answer this? I think that the safety element, a lot of the safety element is wrapped up in a lot of the improvements that are already beginning and starting along 82nd Avenue with the city of Portland's work and ODOT's work, in addition to the other improvements to the network that will occur when you build the transit project. So a lot of the safety elements are wrapped up in either work that's already ongoing or work that is planned to be ongoing. So from the community's perspective, safety wasn't a huge driver of their concern for displacement and pressures to stay in the area longer term. They were more focused on what are the things we need to stabilize our households and our businesses now. Safety is top of their mind. I want to be clear about that. But I don't think it made it into the equitable development strategy because of where it's sort of placed as it's being handled.
Yeah, I would second that. I think it's kind of about the framing of the equitable development strategy around stabilization. I will say that in all of our community engagement that we've done related to the transit project, safety is coming up. Safety is coming up in terms of like roadway safety, and also in terms of personal safety and feelings of safety waiting for and riding transit.
That answer your question, Councilor?
More or less.
All right, any other discussion? Nope. All right, well, thank you all for this update. It's a move in the right direction for our region, particularly a community that has always been impacted, but I think it's a start in binding us together, at least in the city of Portland, into one city. So thank you.
Absolutely.
All right, Chief Operating Officer Communications. The floor is yours, COO Madrigal.
Thank you, Deputy Council President Simpson. Just two items today. I wanted to remind Council that yesterday was our interim P5 Director, Brian Wilson's last day. He is speeding toward family in California. He's relocating. We're really gonna miss him and his humor and his knowledge. But we're happy for him that he's gonna be closer to family. Rachel Limbo has graciously agreed to step in as the interim executive director. Following Brian's departure, Rachel rejoined the Portland 5 in September of 2024 as the interim deputy director after previously supporting Merck Venues as finance manager from 2017 to 2021. So we have an incredible brain there, knowledge of the venues in the lead. We're super grateful to her. And if you're going to see Hamilton tonight or any other upcoming show at P5, you can thank Rachel for holding down the fort for us. Also, second news, wanted to share a little tidbit from the zoo today. A combination of warm, sunny weather, winter discount pricing, and interest in our month-old Asian elephant, Tula 2, brought almost 25,000 people to the Oregon Zoo over the weekend. 25,000. So kudos to the zoo team for managing that. I heard it was just like incredible, the amount of folks that were up there. The influx of visitors did strain parking capacity, but the zoo worked hard to keep everyone, including Rose 2 and Tula 2, happy on their visits. And as a reminder to the public, you can always take the Max to the zoo if you want to avoid the parking situation. Thank you.
Thank you, Marisa. Shout out to Tula too. Everybody wants to see the baby.
She's so cute.
Everybody wants to see the baby. Councilor Communications. Councilor Rosenthal.
Yeah, I just want to report that there was the center had a big gala last Friday night, and Councilor Gonzalez here did an outstanding job as the host for the live auction. Got people to raise their cards and buy and bid on a bunch of very interesting projects. So that was quite entertaining, and the music was really quite interesting and very good. But thank you.
Of course. Councilor Gonzalez.
For sure. Well, I kind of talked about this during the oversight committee discussion, but yesterday the region broke ground on a Hillsborough shelter, which received $8.3 million from SHS for construction. Some like quick facts on the shelter. There's 75 beds. It's the first permanent year-round shelter in the history of Hillsborough. We'll have 24/7 on-site support. Mental, behavioral, and physical health services will be on site, so we'll have an integrated care approach. And there's a whole bunch of different gymnastics that local partners had to work through over the last few years to make this project happen. So that's awesome. And also, this lot is directly on TV Highway, and so it'll have access to transit and things like that. So just want to celebrate that. It'll open in the winter later this year, so 25, 26. And yeah, it was a great moment.
Thank you, Councilor Gonzalez. Councilor Lewis.
Sure, thank you. Chair Nolan and I were at the Regional Solid Waste Advisory Committee on Thursday afternoon and feel like it's important to bring back the review and comment from the facilities plan. I'd say overall, some good support for the direction, some questions around how we're gonna finance depots, loud and clear requests that we do rate setting earlier instead of later from our jurisdictional partners who need rate setting done in time for their budgets. The other, I think, point to really bring back was some critique about reuse small as prioritized or round one investment.
Thank you, Councilor
Did I
Lewis.
say it all?
Oh.
Well, you weren't putting your hand up.
That was just last week.
Mhm.
I also add that there was very good discussion around government-private partnerships. As we all know, our solid waste and recycling system is an amalgam of Metro-owned facilities and privately owned facilities. I heard a lot of interest in probing with the depots and with some other major pieces of the facilities plan, that we be intentional about how we implement that. And since public-private partnerships have been very successful, to keep that in mind.
Okay. Seeing no more communications, thank y'all for that. This council session is adjourned. We will now take a short break and convene into council meeting at 12:15. We'll see you back here at that time. We will now convene in this meeting. Come back in 15.
We'll be back 12:15 here.
That was. Sorry.
so unkept.
Yeah, I mean, it was worth the response.
Right.
There's no response.
I don't know how to respond.
Shall we get
Look.
going?
Okay.
Just look.
Where are we on the agenda? Counselor, thank you. Starting out with public communication. Okay, declare a quorum and call the meeting to order.
No, that's the second part. That's the whole.
Why don't you kick us off?
All right.
I'm not really sure what's going on.
All right. So,
Much
Ann, will you
appreciated.
please declare a quorum and call the meeting to order?
You bet. We have a quorum.
Yes, we have everybody here. Everybody's here. I will now open public communications on non-agenda items. And will you please describe to the audience our procedures that will be used for public communication portion of the meeting?
Absolutely. If anyone wishes to testify on non-agenda items, now is the time to do so. Public testimony will be limited to 3 minutes. We will manage a timer to go off at the 3-minute mark. If you have not already signed up to speak, you can do so now. If you're joining us on Zoom, you can sign up to testify by raising your hand on Zoom. Depending on your version of Zoom, the raise hand function has its own tab or is located within the reactions tab. Those calling in can raise their hands by dialing *9. If you are joining us in person, you can sign up by filling out one of the blue cards in the back of the room and bringing it up to me. And for those joining on Zoom, I will promote you to a full panelist when it is your turn to testify. I will call your name or phone number when it is your turn, and a window will appear asking you to accept being promoted to a panelist. Once you accept, your Zoom window will close for a brief moment before you rejoin as a panelist, where you will be able to turn on your camera if you like. As a reminder, you do not need to give your physical address. However, please introduce yourself for the record before testifying. And I do not see anyone signed up to testify. And are there any hands raised? No, there are not.
All right, thank you. With that, we will close public communication on non-agenda items and move on to our ordinance. Thank you, Councilor Simpson, for picking up where I left off, or I'll pick up where you left off. We do have one ordinance before us today for a first reading and public hearing, and that is ordinance number 25-1530 for the purpose of amending Metro Code Section 11.01. 0.130 administrative cost recovery concerning use of administrative funds and declaring an emergency. Councilors, as you know, and heard reiterated in today's report from the Supportive Housing Services Oversight Committee, there are significant needs in our region for SHS funding. And I want to thank you all for your support last Thursday when I said I intended to bring forward legislation to address these funding gaps and current challenges while also bolstering our regional homelessness response. We all know that the SHS tax is a volatile funding source, and I want to appreciate the Metro staff for their sound financial practices and conservative budgeting along the way, which means that Metro maintains around $30 million in unspent revenue held in our administrative fund, which currently can only be spent on administration. The legislation I'm introducing today would allow Metro, subject to criteria, to be adopted by Metro Council in a separate action to distribute dollars from our administrative fund to local government partners. We have many more conversations ahead about the best ways to utilize our funds strategically, but for today, I'm introducing this ordinance to ensure we always have the flexibility to act quickly. I want to emphasize 2 things. First, that this is a first step Metro Council will need to later adopt criteria to determine how and to whom these dollars can be deployed. This will need to be considered how funds are distributed appropriately across the 3 counties. And second, these are dollars that were collected and unspent in prior fiscal years, and they are one-time only dollars. They are available for allocation now, but we will not have this amount of unallocated funds in future years. Oversight and accountability is more than a red pen. It means working as partners to identify new opportunities and helpful gaps that keep the entire regional system strong. With that, can I turn it over to our attorneys to give a quick overview of the ordinance?
Sure. Thank you, President Peterson and councilors. I'm here with Shane Ebman, and together the 2 of us will provide you with an overview, or maybe I will because it's relatively straightforward, and then we can answer any questions. The ordinance just, you know, in its body and its whereas clauses lays out the reasons why Metro needs to have this, you know, this flexibility. And then in terms of the substance of it, we've really done two things. We did apply our plain language principles, which we always do when drafting. And this is simply, I think you can think of it as enabling legislation. President Peterson hit all the right notes. It adds an additional authority for use of administrative funds that come to Metro, and it does establish that Metro will establish the criteria prior to committing any of those funds. That's really what I would emphasize for the council. There is an emergency clause so that it would become effective immediately upon adoption, but as of yet, the ordinance has not been scheduled for a second reading.
Thank you. Council, any questions for our attorneys? Councilor Lewis.
Sure, thank you so much. Thank you for walking us through that. The text of the code itself uses the words local government. Do we have a previous reference to what we mean within the code by local government, or where do we look for that definition?
Thank you, Councilor Lewis. The reason why we use that terminology is that's a terminology that's actually already used in our code with respect to supportive housing services. It says that we can give these supportive housing services funds or revenue from the tax collections to local governments. That term would follow what is known in state law by definition of local government. I don't think we find it elsewhere in this chapter. So it would include cities as well as counties.
But it would not include special districts.
I think in the criteria that you would adopt, we would exclude any other local governments that were not eligible for these funds.
Great, thank you.
Any other questions? Councilor Wong.
Thank you, Madam President. Are we to read the section A and B like together? I'm just wondering if in section A, eligible uses for the fund are data collection, reporting, and supporting regional collaboration and supporting the oversight committee. Does that restriction apply in B, or is that where you're saying must be used for some housing programs but not otherwise subject to requirements?
Yeah, so thank you, Councilor Wong and councilors. The language of the ordinance or the code should be interpreted that this is an additional use of funds. So in addition to those three items that you enumerated, Metro Council can also spend administrative funds on other or can fund grants, let's say, to other local governments for the provision of supportive housing services. But the reason why the end of that provision says they're not subject to other requirements, unless Metro Council specifically identifies as we understand that these would be for one-time only funds for sort of targeted purposes, and therefore would not be appropriate to require such a local government to go through and develop a wholesale 10-year local implementation plan in order to receive the funds. So that accepts those local governments in receipt of these funds from certain other requirements that would be made for our counties who currently operate the majority and receive the majority of the supportive housing services.
Okay, thank you.
Councilor Gonzalez, thank you.
Thank you. Thank you for bringing this to us. A question. So like there are different rules that apply to the money that as we distribute it, right? And I'm wondering if the resources here would be held to the same standards of the formula that is allocated to each of the counties. Like would we be required to follow that once we go into that? Or does this fall under the umbrella of a different allocation method? For example, within our 5% cap, I don't think that formula of investment criteria applies to that 5%. So can you kind of help me understand that a little bit more?
Yeah, so Councilor Gonzalez, as I understand your question, my response is that the administrative funds are funds that are held by Metro and therefore not subject to that percentage allocation. Should Metro Council decide as part of its criteria that it wants to do that, it could. But as a fundamental aspect, these administrative funds are collected or held prior to the percentage distribution to counties that's in our code.
Thanks. That's really helpful clarification.
Thank you. Counselor Wong.
Sorry, one more
No, it's
technical
okay.
question. If it's not, let's see, otherwise subject to requirements, does that mean that this funding that could go to local governments will not potentially kind of be counted in the population and population A and B distribution?
And Councilor Wong, that's a good question. And again, I think those are the types of criteria, if you wish for them to apply to the release of these funds, I would recommend that you include them in the resolution that adopts eligibility criteria.
So we have to do that now, or we can do that?
No, this is just enabling legislation. And then your second step, as Council President Peterson sort of alluded to, would be to actually adopt the criteria, both for eligibility and for how those funds could be used.
Thank you.
Awesome. Any other questions? Not seeing any hands raised. All right, shall we proceed into public hearing? Head nods? Okay. We will now open the public hearing on ordinance number 25-1530. Anne, will you please describe to the audience our procedures for the public hearing?
Sure. For anyone just joining us, if you wish to testify on ordinance number 25-1530, now is the time to do so. Public testimony will be limited to 3 minutes, and we will manage a timer to go off at the 3-minute mark. If you have not already signed up to speak, you can do so now. You may sign up to testify by raising your hand on Zoom, which, depending on your version of Zoom, the raise hand function either has its own tab or is located within the reactions tab, and those calling in can raise their hands by dialing *9. I will promote you to a full panelist when it is your time to testify and call your name or phone number when it is your turn. And a window will appear asking you to accept being promoted to a panelist. Once you click accept, your Zoom window will close for a brief moment before you rejoin as a panelist, and you will be able to turn on your camera if you like. As a reminder, you do not need to give your physical address, but do introduce yourself for the record before testifying. And if you are here in person, please grab a blue card from the back of the room and bring it up to me, and we will make sure you get to testify. Thank you. We have no blue cards and no one on Zoom with their hand raised. Thank you. Oh, excuse me. Thank you. No, thank you.
Auditor Evans, go ahead. Come forward.
Thank you, Auditor.
Good afternoon.
Thanks for having me. I'm in the unusual position of testifying publicly on a matter before you. I think it's important, my office's role in increasing accountability and transparency to the public, Metro's programs and services, to kind of get on the record some thoughts from that lens. So my office has completed 2 audits of the regional SSGS program, and I think some common themes on those audits have been flexibility. Flexibility on criteria, flexibility on what the outcomes are, flexibility on what happens when things don't go as expected. And so I'm coming before you today to think about, are we repeating the same pattern here? Are we making a quick decision to address the political issue of the day at the expense of something in the future that you may want to reconsider? And so when I really think about what I'm trying to get across in this testimony, is to really think about slowing down so that you can make the right decisions. And so I really would hope that you maybe take a pause here and think about how quickly and abruptly this measure has been pulled forward. The ordinance, I think it was announced in the end of the meeting on Thursday. So we've had Friday, the weekend. I don't know when the ordinance was posted online, but I'm guessing it was yesterday. And so I would say the public and jurisdictional partners may or may not have had a lot of chance to digest what's going on. Obviously, you can do what you need to do to move forward, and obviously creating flexibility may be advantageous at this moment, but I think there's also the chance for unforced errors. And so when I think about flexibility, when I've looked at the audits in this program before, it's really helpful to have flexibility at some points, and then sometimes you wish you would stop and slow down and say, really, what criteria are we trying to address? How do we want to use these fundings? And I think that's really coming to you today to think. It's great. I think you'll be able to get approval by the council at some point to get an ordinance to increase the flexibility of the administrative rules, or the administrative funds, but I hope you would also do that in companion with the actual criteria. What criteria do you want to see to make these changes? Because if you make the change now, you open up that process to 26 other cities in the region. There's only $30 million as far as I can tell. Once you start to spread that out or try to figure out an allocation model, I think you're going to end up with a pretty political process. And I think you're already in the middle of a very political process. And so I would urge you maybe to stop, give yourself a little time to develop the criteria first, and then bring the ordinance to change your ability, as well as some criteria with why and how you're going to allocate that at the same time, so that both everybody knows what's going on at the same time, and so you have some ability to say no when you have things that maybe don't want to fund. Sorry for coming before you on the last minute, but also recognize that just like the public, I don't have a lot of time to react to these kind of things as well. So again, the purpose of having these public hearings is to give the public a chance to think about what your proposed changes are. I would argue that this has not been sufficient. Thanks.
Thank you. Any further?
Sorry. My name is Brian. I'm the elected auditor of the region. Apologies for the informality. I'm not used to testifying publicly. I did not turn in my blue card in advance, so apologies for that. But for everybody who's watching, Brian Evans, the elected Metro auditor.
Thank you. And do we have anybody else?
No, we do not. Thank you.
All right, with that, we will close the public hearing on ordinance number 25-1530. And we will set a date for the second reading and vote on this item, and will be posted online once that's determined. Thank you. With that, seeing as though you've already gone through COO communication and counselor communication before we leave and adjourn, I'll just say thank you for letting me be absent this morning while I attended the Multnomah County Commission meeting to talk about SHS reform. It was well received by the county commissioners, and there's a lot of talk about working together to move forward in a more transparent and accountable way. And I think if that was one theme, I think the other theme was, yes, we want regionalism. We want regionalization of this measure, but we also want the autonomy of the county retained. So balancing those two things is always going to be a challenge as we move into regionalization of a program. But I think that we have folks that are willing to understand compromise and move forward. But it was a good meeting. That and anything else to come before the council? All right, we are adjourned. Thank you.